Okay, let's unpack this. Welcome to the deep dive, where we take a stack of information, could be articles, research, maybe notes you've scribbled down, whatever you've got, and we really sift through it all. Our goal, to bring you the absolute core insights.
Right. We're looking for those surprising facts, the essential bits of knowledge that just help you feel a little more informed, maybe a bit quicker.
Think of us as your expert guides, sort of navigating that information overload that's everywhere.
Exactly. We're here to help you connect the dots, understand not just what's being said in the source material, but maybe more importantly, why it genuinely matters and what it might mean for you.
Spot on. And today, we are embarking on a pretty significant deep dive. It's about something that hopefully becomes relevant to all of us eventually, navigating health and well-being as we age, specifically once we hit that 50-year mark and beyond.
Yeah, what are the real, physiological changes happening? And maybe more to the point, what proactive steps can you actually take to support your health and keep enjoying life?
Precisely. The source material for this one is particularly good. It comes from a detailed conversation with Dr. Audrey Chun. She's a specialist, very experienced, in geriatrics and palliative medicine at Mount Sinai Medical Center.
Which means she has a deep understanding of the specific needs and the changes that happen as people get older, a wealth of knowledge there.
So our mission for this deep dive is pretty clear. We're going to unpack in detail those significant physiological shifts that come with age, especially after 50.
We'll explore Dr. Chun's insights on proactively managing health. We'll get into the non-negotiables, movement, social connections, smart nutrition.
Right. We want to pull out the most practical, maybe inspiring, and definitely actionable takeaways from her expert view. Things you can think about, maybe even start doing, right now.
So if you're in your 50s, 60s, 70s, or even younger, and just curious about what's ahead, what to expect, and how to maybe navigate it best for your own well-being, this deep dive is absolutely for you.
We're digging into the why behind the changes and the very practical how of aging well, drawing directly from our expert source.
Okay, let's dive right in.
All right. To set the stage, our main source today, as we said, is this conversation with Dr. Audrey Chun. She specializes in two fields that are really linked, geriatrics and palliative medicine. Can you maybe elaborate a bit? What do those actually mean for caring for older adults? And where does she practice?
Yeah, absolutely. So Dr. Chun's expertise is right in understanding and addressing the complex changes in our bodies and health as we age. Geriatrics, that's the medical field, focus purely on the healthcare of elderly people.
Okay.
It's not just treating diseases one by one. It's understanding how they might show up differently in older bodies, how multiple conditions interact, and how age itself, influences health.
And palliative medicine. I think sometimes people hear that and immediately think end-of-life care, but you're saying is broader.
Exactly. It definitely includes supporting people with serious illnesses, yes. But the core idea of palliative medicine is relieving symptoms and stress at any stage of an illness. The main goal is improving quality of life for the patient and their family.
Oh.
So when you combine geriatrics and palliative medicine like Dr. Chun does, you get a doctor who really understands not just the physical changes and illnesses of aging, but also how to holistically support someone's overall well-being, their comfort, their quality of life, focusing on what truly matters to them.
That combination sounds incredibly valuable for this topic, and she practices at the Martha Stewart Center for Living at Mount Sinai. You mentioned she made a point which seems important, that it's not like a community day center, it's a medical practice.
That's right. It's a clinical setting, basically a doctor's office where patients get comprehensive medical care designed for their needs as older adults. And the philosophy there, especially for adults usually over 75 in their practice, though the changes start earlier, of course, is what they call whole person care.
Whole person care. We hear that phrase, sounds good, but what does it actually mean in practice, based on what Dr. Chun described? How does it change the care someone receives?
This is where you see a real shift, based on her conversation, maybe compared to a more traditional, purely disease-focused approach. Dr. Chun really emphasizes that whole person care means matching the medical care not just to a list of diagnoses someone has collected, but fundamentally matching it to what that specific patient values and prioritizes most right now at this stage of their life.
Okay. So it moves beyond just ticking off conditions on a list to really tailoring everything to the person's own goals, their priorities, their life situation.
Precisely. It's about looking at the whole person. Their physical health, yes, but also their ability to function day to day, their cognitive state, emotional well-being, social life, and their personal goals for living. The focus is enabling them to live the life they want.
Which probably means not automatically reaching for another pill for every new issue.
Often, yes. It means looking beyond just adding more medications. Medication is vital, obviously a key tool. But the starting point for care is always, what's most important to you? What do you want to keep doing? What activities make your life meaningful right now?
That focus on the patient's own values must really shape the kinds of treatments or support they recommend. Can you give some concrete examples from her insights? How does this whole person care actually play out?
Yeah, she gives some great practical examples. Often, the plan isn't just prescriptions. It heavily involves lifestyle changes. They focus hard on connecting people with resources outside the clinic.
Like what kind of resources?
Things like community exercise classes designed for older folks, or maybe social programs to combat isolation. Referrals to physical therapy are common not just after an injury, but to maintain strength and balance for everyday life. Occupational therapy might come in to help adapt tasks or the home environment. And they pay really close attention to things often overlooked, like sensory needs, making sure hearing aids are working right, or vision is optimized. Because poor sight or hearing, that can massively impact everything. Safety, balance, socializing, even cognitive function.
So it's this really multifaceted approach, looking way beyond the medical chart. It's function, social life, senses, everything contributing to living fully.
Exactly. The whole system tries to understand what's most important to you. Maybe it's walking around the block, maybe attending church, maybe seeing grandkids clearly on Zoom. Once that core goal is clear, the medical and support system gets tailored to help achieve that, not just treating a lab number in isolation. It's a powerful way to reframe healthcare in later life.
Yeah, shifting from just managing decline to actively supporting the life you value.
That perspective, aligning care with personal values, it really provides a strong foundation for understanding the specifics of what happens physically as we age and, what we can do about it. It frames healthy aging not just as avoiding problems, but actively pursuing the life you want.
Okay, so with that whole person care idea in mind, let's shift to the physical side of things. Dr. Chun is careful, not to just blame everything on getting older, but there are definite physiological shifts happening as our bodies age.
Right, that's a key distinction she makes. Aging is a process, and if we're lucky enough to live long lives, our bodies will change. And she helps break this down, highlighting key periods.
Starting around the 50s, she points to a major transition, especially for women.
Yes, the 50s decade. For women, often characterized by menopause, that's a huge physiological event, hormones shifting, estrogen levels decreasing eventually. And according to Dr. Chun, while there are various effects, the biggest consequence she often sees from these hormonal changes is a noticeable decrease in bone health and muscle mass.
A drop in bone density and muscle mass starting around the 50s, especially for women. That feels like a really critical point. She mentioned, didn't she, the value of building bone and muscle before 50, like building up reserves, but then it becomes absolutely vital to support it strongly in the 50s and beyond.
Absolutely. Our body's ability to build new bone and muscle just naturally slows down with age. So any capital you built earlier, that's great. It helps. But the real focus after 50 shifts to preserving what you've got and using strategies to slow down the loss as much as possible. And ideally, maybe even build some back if you're starting later.
Okay, so what are those key strategies she outlined? The essentials for keeping bones and muscles healthy, especially post-50.
Well, the first pillar is diet. Getting enough calcium and vitamin D is absolutely essential for bone density. Dr. Chun really emphasized getting as much calcium as possible from whole food sources first.
Like what specifically?
We're talking dairy milk, yogurt, cheese, leafy greens like kale, broccoli, and foods that are fortified with calcium, like some plant milks or orange juices.
Why the big push for food first instead of just taking a calcium pill?
That's a key point she made, and it's backed by research. Calcium supplements can help if your diet isn't enough, sure. But some studies have raised flags that very high doses of calcium taken only as supplements might possibly be linked to certain heart issues in some people.
Yeah, those concerns haven't been seen when the calcium comes from food. Calcium in food comes packaged with other nutrients that help absorption.
Yeah.
The body just seems to process it differently. So the advice is, figure out how much calcium you get from your diet, aim for around 1,200 milligrams a day for women, and only supplement to cover the gap if there is one.
That's a really important distinction. Check diet first, supplement smart if needed. What about the other pillar? Exercise.
Exercise is completely non-negotiable for both bone and muscle health. Dr. Chun specifically stressed needing weight-bearing and strengthening exercises. This is more than just cardio, though cardio is important too for overall health.
Okay, weight bearing and strengthening. What's the specific benefit there for aging bones and muscles?
So weight-bearing exercise, it's anything where you're supporting your own body weight against gravity. Think walking, jogging if you can, dancing, climbing stairs. That puts stress on your bones.
That stress actually signals your bone cells to maintain or even increase density. It's that classic use it or lose it idea for your skeleton. Then strength training, working muscles against resistance, like lifting weights, using bands, or even body weight stuff like squats or push-ups that directly builds and maintains muscle mass and strength.
And that's crucial because muscle loss accelerates with age.
Exactly. That muscle loss, sometimes called sarcopenia, it picks up pace. Fighting that requires actively working those muscles.
So these kinds of exercise literally tell your bones and muscles, hey, stay strong, even if you're starting later.
Precisely. It's easier to build that foundation younger, no doubt, but these exercises are still incredibly effective at slowing down the loss and maintaining function as you get older. And this need doesn't stop in the 50s. Dr. Chun points out this trend, decreasing bone density, losing muscle mass, it continues right through the 60s, 70s, 80s, and beyond for men and women both.
Which makes holding on to muscle mass incredibly critical. You linked it directly to staying functionally independent.
Absolutely critical. I mean, think about it. Muscle mass isn't just about looking strong. It's fundamental for doing everyday things, getting out of a chair, walking, carrying groceries, just holding yourself upright. And crucially, enough muscle strength, especially in your legs and core, is essential for good balance.
Right, balance is key.
When you lose muscle, your balance gets worse. And that directly, significantly increases your risk of falling. Falls are just a massive cause of serious injury, hospital stays, and losing independence for older adults.
So keeping muscle means better mobility, fewer falls, which connects right back to that whole person care idea.
Yeah.
Supporting your ability to do the things you want to do.
Exactly. The physical goal in later decades really shifts. It's about maintaining strength, endurance, and balance, not necessarily for athletic achievement, but specifically to support the best possible quality of life and physical independence for as long as you can. Those specific exercises, balance, flexibility, strength, they become tools for living the life you value.
That really reframes the why behind exercise later in life. It's about capability and freedom. Now, as we move through these decades, say into the 60s and beyond, Dr. Chun mentioned we become more susceptible to chronic health conditions. What are some common ones she often sees popping up around this time?
Yeah, it's just a reality for many people that chronic conditions become more common as we age. Things like high blood pressure, type 2 diabetes, these are often picked up in routine checkups starting in the 50s and 60s.
And what's her key recommendation linked to that likelihood?
Her advice is crystal clear and really vital. If you haven't already got a regular primary care doctor you see consistently in your 50s, now is definitely the time.
Why is that relationship so important then?
Having that primary care doc allows for regular monitoring, catching early signs of these conditions. It gives you a consistent person to manage them if they do develop, and it ensures you stay on top of important age-appropriate screenings for various cancers, other issues.
So that regular doctor relationship is really foundational for proactive health management as we age. And the usual approach to managing these chronic conditions when they do arise.
It's almost always a combination. Medical intervention, often medication, plus significant lifestyle changes. It's rarely just one or the other.
Right.
Diet changes, more physical activity, managing weight. These work together with prescribed meds to handle things like high blood pressure or diabetes effectively. And sometimes those lifestyle changes can actually boost how well the meds work, maybe even help reduce the need for certain drugs down the line.
But she also talked about conditions people might experience but, feel are just an unavoidable part of aging. Or maybe feel a bit embarrassed to bring up, yet they're actually common and often manageable.
Yes, this is such a critical area she highlighted, because dealing with these can make a huge difference in overall well-being and function, but people often just don't mention them to their doctor. Bringing them up is key.
What kinds of conditions are we talking about?
Okay, things like urinary incontinence. That just means trouble controlling your bladder, maybe leakage, or feeling like you have to go right now. More common in women, especially after childbirth or menopause, but men get it too, often becomes more noticeable 60s, 70s, 80s.
Okay, what else?
Balance issues. Just feeling unsteady even if you haven't actually fallen, that's a big one. Changes to taste and smell, surprisingly important. They can lead to eating less, not feeling thirsty, maybe losing weight without meaning to, which isn't healthy. And of course, gradual changes in hearing and vision are very common.
And it's easy, if you're listening and experiencing some of that, to just think, okay, well, this is just getting older. Guess this is my new normal.
Exactly. And that's the mindset Dr. Chun really pushes back against. She strongly emphasizes that having these issues is not necessarily something you just have to accept and live with passively. Often, there are effective treatments, therapies, simple strategies available to optimize these conditions and significantly improve your function and comfort.
And she made a really powerful connection that not dealing with these seemingly minor issues actually increases your risk of bigger problems later. Expert seeker. Yes, this point is crucial and so often missed. She explicitly said that failing to address or treat these conditions, even the ones that feel like just annoying inconveniences or maybe embarrassing things you cope with, actually puts you at a higher risk for developing disability and even cognitive impairment or dementia down the road.
Wow. So something like bladder leakage or being afraid of falling or even untreated hearing loss. It's not just an isolated physical problem. It can cascade into affecting brain health and independence.
That's exactly her point. Think about the ripple effects. If you have incontinence, maybe you're scared to leave the house much. That cuts down social interaction, physical activity. If you have balance issues or fear falling, you naturally get less active, avoid going out, stop doing things you enjoy.
Yeah, you shrink your world. Right. If your hearing's bad, you might withdraw from parties because it's too hard to follow conversations, leading to isolation. If taste or smell changes mean you're not eating or drinking well, that impacts your overall physical health, energy levels, which affects your brain and body. All these things, if left unchecked, lead to less activity, less social connection, less brain stimulation, and a higher risk of functional decline and cognitive problems.
That's incredibly eye-opening. It really turns these minor issues into red flags that need attention because they're tied into keeping both physical and cognitive vitality.
Absolutely. The takeaway is powerful. Don't hesitate. Don't feel embarrassed. Bring any health concern, no matter how small or age-related it seems, up with your doctor. Often, simple steps can lead to big improvements in function, comfort, and critically, help lower these larger risks. Don't just accept them.
That connection between seemingly small issues and broader health, including brain health, flows perfectly into the next point, the impact of sitting and inactivity. Sometimes these conditions, or just general aches, might lead people to, well, move less.
That's a totally understandable reaction to pain or fear, isn't it? If something hurts, your instinct is often to just rest it. But Dr. Chun's advice here is quite direct and strongly backed by evidence. We really should try to stay as active as possible and, conversely, sit as little as possible, especially as we get older.
And she brings up that powerful, maybe sometimes harsh principle, use it or lose it.
She does, because it's so relevant here, especially for muscle, bone function, overall mobility. She explains that functional capacity, your ability to move, balance, do daily tasks, it's very easy to lose when you become inactive. But once it's gone or way down, it's remarkably hard, though not impossible, to get it back. So finding and keeping that motivation to keep moving, even within your body's limits, is just crucial for preserving that function.
Now, it's important, as she clarified, this doesn't mean like pushing through agonizing pain or ignoring safety if your balance is really off.
Exactly. Safety first. Always. You have to listen to your body. If moving causes severe pain or puts you at high risk of a fall, you need to be cautious. Ideally, get professional guidance, like from a physical therapist. They can assess your specific limits and design a movement plan that's safe and effective for you. The goal is movement, yes, but not at the cost of getting injured.
Right. But the incredibly important, really encouraging message she had was that movement doesn't have to be some dramatic, intense thing, especially if you're starting from, being pretty inactive. This pushes back against that intimidating idea that you have to go from 0 to 60, like hitting the gym hard or running miles.
This is maybe one of the most actionable and empowering takeaways. She gets that for someone who's been mostly inactive due to pain, fear, or habit, suggesting they start some vigorous program is just unrealistic. So she gives these wonderfully simple, specific, like micro-actionable examples, things almost anyone can consider.
Like literally walking for just 1 minute a day, was that one?
Yes, that's one example she gave. If you're doing almost nothing, just try walking for 1 minute. Or maybe marching in place for 1 minute. Or another one that sounds simple but can be tough for some sedentary folks. Just practice standing up from a chair and sitting back down 10 times a day.
Standing up and sitting down 10 times. That sounds almost laughably easy, but yeah, for someone with significant muscle weakness or balance issues, that is a real physical challenge and a fantastic starting point.
It is, and that's her point exactly. The key is consistency and starting somewhere. Any activity, even these tiny incremental steps, is profoundly beneficial if you've been largely inactive.
And if you're already active,
Then the goal shifts. Try your best to maintain that level. Maybe look for ways to sneak more movement into your day to break up long periods of sitting.
she did briefly mention the long-term payoff of having been active earlier in life.
Yes, big long-term studies definitely show that people who kept up physically active lifestyles in their younger and middle years generally have better health outcomes, less chronic disease, less disability when they're older. Those earlier habits build a kind of physical resilience.
Which might make some listeners who maybe weren't super active feel a bit regretful or think, well, shoot, it's too late for me then.
And this is precisely where Dr. Chun offers such a powerful, evidence-based message of hope. She stresses, without any equivocation, it is never too late to start moving more. She cites research showing that even for people who are quite frail, maybe in nursing homes, very limited mobility, implementing even small, gradual increases in activity brings measurable benefits.
And benefits beyond just the physical.
Yes, not just physical, it extends to improving mood, potentially helping cognitive function by boosting blood flow and stimulation, and just enhancing overall well-being.
So that thought, why bother starting now, I didn't do it before, is basically just wrong, according to the evidence.
It's absolutely incorrect. Her message is a fantastic antidote to that kind of thinking. Even tiny steps make a difference. You can start today right where you are, maybe with 1 minute of walking or a few sit-to-stands, and you will gain a benefit in function, resilience, well-being. That's incredibly inspiring for anyone feeling discouraged.
It really makes fitness feel accessible. It's not about peak performance. It's about consistent, doable effort from wherever you are right now. Okay, moving beyond the strictly physical, Dr. Chun also really stressed the vital importance of mental well-being and social connection. She linked these directly to fighting off potential feelings of loneliness or depression, which unfortunately can become more common with age.
This is a huge, often underestimated piece of the healthy aging puzzle, and it's a core part of that whole person care idea we talked about. Loneliness, social isolation, these are significant issues for many older adults, and Dr. Chun explains sort of the underlying reasons why this can happen.
Why does loneliness tend to creep up as people get older?
Well, it's a tough reality, but as people age, their established social networks just naturally tend to shrink. Friends, siblings, maybe a spouse might pass away, kids might move far away. Health problems can make it physically harder to get out, visit people, attend gatherings.
Right.
All of this means the number of people you regularly interact with can really narrow over time. That can lead to increased feelings of isolation and loneliness, even if you technically live with someone.
That paints a clear, maybe a bit sobering picture of how social circles can contract.
It does. But Dr. Chun's strong point here is that knowing this reality allows us to be proactive about it. She emphasizes that maintaining social connections is incredibly important, and not just for emotional support, but also for maintaining mental well-being and, maybe surprisingly to some, cognitive health, including memory function.
How does being social help your brain?
Social interaction gives you cognitive stimulation, it reduces stress, it keeps you engaged with the world around you. All of those are protective factors for brain health. Isolation, on the other hand, is a known risk factor for depression, anxiety, and even a faster rate of cognitive decline. It might even increase the risk of dementia.
Wow. So nurturing your social life is literally a strategy for protecting your brain, not just your mood. What strategies did she suggest for keeping those vital connections strong?
She suggested focusing on the quality of the relationships you do have. Even just a few close, meaningful connections can be more powerful than a huge network of casual acquaintances. So nurture those existing bonds, regular calls, visits, shared activities.
Okay, focus on quality.
And then she offered her rather funny, but actually very practical suggestion. Make friends with people who are 10 years younger than you.
Light chuckle. That's a fun one. Get some friends who aren't necessarily facing the exact same age things at the exact same moment.
Exactly. It sort of ensures you have a longer potential runway for sustained friendship, and it brings different perspectives into your life, too. She also highlighted something really interesting, a surprising positive that came out of the pandemic challenges.
Which was?
The successful adaptation of so many older adults to using video technology, things like FaceTime, Zoom, to stay connected.
That was a remarkable shift for a lot of people. She said she wouldn't have predicted her 90-year-old patients becoming Zoom pros just a few years back.
It really shows that capacity for adaptation, for learning, even later in life when the motivation is strong enough. She pinned that success mainly on two things: Genuine curiosity, like, I want to see my family, so I'm going to figure this out. And crucially, getting help from others to learn the tech. She gave examples like writing groups that couldn't meet in person anymore, but figured out how to keep going via phone or video calls, maintaining that vital connection and shared interest.
That's a really inspiring example of overcoming barriers just for connection. It shows that even with physical limits or distance, technology offers new ways to keep those social ties strong, ways that weren't really used as much before.
It really highlights that connection is possible and that making the effort, being willing to learn, can open up new social doors. But what if someone is feeling isolated and just doesn't know where to even start finding new connections or maybe rekindling old ones? Dr. Chun also pointed to some valuable practical resources.
And what kind of resources did she suggest?
She specifically mentioned the role of social workers. A lot of medical practices that focus on geriatric care, like hers, actually have social workers on staff. These professionals are experts at connecting people to community resources.
How does that work?
They can talk with you about your interests. Maybe it's reading, music, gardening, volunteering, teaching, whatever, and help you find local groups or programs built around those interests.
So maybe ask your doctor's office if they have a social worker or can refer you.
Exactly. It's a direct path to getting personalized guidance. She also suggested looking for community through places of worship, churches, temples, mosques, other religious centers. They often have strong community ties, social groups, volunteer opportunities that can help you connect with others who share similar values.
And what about senior centers? Still a good resource.
Absolutely. She highlighted senior centers as a fantastic resource. They often offer a huge variety of programs, classes, meals, social elements. Crucially, many senior centers also have social workers or staff who can help people navigate what's available, figure out how to join in, and find new social networks based on their specific interests and comfort level. Calling your local senior Caesar or checking their website is a great first step if you're looking for in-person connection.
So figuring out your interests and then actively looking for communities and resources based on those interests, that's a concrete strategy for fighting loneliness and supporting overall well-being.
It truly is. Don't underestimate the power of human connection. It's just as important as diet and exercise for both your mental state and your cognitive health.
That brings us nicely to our final pillar of healthy aging from Dr. Chun. Nutrition. Gosh, there's so much conflicting info out there, so many fad diets. What are the core evidence-based principles she emphasized for eating for health as we get older?
Yeah, she really tried to cut through that noise by focusing on the fundamental principles that are common across almost all dietary patterns shown to be good for long-term health. Her approach is really practical, sustainable.
Okay, what are those core principles?
First off, she advocates for a more plant-based way of eating. Now, this doesn't mean you have to go full vegetarian or vegan, but it means making fruits, vegetables, legumes, whole grains the main stars of your diet.
Why the emphasis on plants?
They're just packed with vitamins, minerals, fiber, antioxidants, all vital for cellular health, reducing inflammation. So build your meals around plants. This ties into the second principle. Focus on whole foods. Choose foods that are minimally processed, closer to how they grow. Whole grains instead of refined ones, a piece of fruit instead of juice, cooked veggies instead of chips. Whole foods give you essential nutrients, fiber, help regulate blood sugar, and keep you feeling full, better than processed stuff.
And protein is still important.
Absolutely. Get adequate protein. Whatever sources you like, lean meats, fish, poultry, eggs, dairy, or plant sources like beans, lentils, tofu, nuts. Protein is crucial for maintaining muscle mass, which, as we've talked about, is vital for strength, function, preventing falls.
And then the M word, moderation.
Key to everything. Moderation, especially with added sugars and excess salt. Small amounts are fine, but too much is linked to higher risk of inflammation, weight gain, high blood pressure, diabetes, stuff that gets more common with age. She also specifically mentioned moderation with alcohol.
What was the guideline there?
Recommending no more than 1 alcoholic beverage per day for both men and women as you get older. She noted potential interactions with medications and the impact on balance as key reasons for that tighter limit.
Right. That 1 drink limit for both men and women is maybe stricter than some general advice, highlighting specific concerns later in life. She also had that simple visual guide for balancing meals, which I thought was really helpful.
Yes, it's wonderfully easy to use. She suggested picturing your plate for each meal. Aim to fill half of it with fruits and vegetables, lots of different colors, is great for getting varied nutrients. Fill 1/4 with your protein source. And the last quarter can be a carbohydrate you enjoy, preferably a complex one like whole grains or starchy vegetables.
Half plants, quarter protein, quarter carb. Simple, actionable, helps get that nutrient balance. What about weight? Is there an ideal weight goal as we age?
She talked about aiming to maintain a healthy weight for your individual body, knowing that can shift. Metabolism does tend to slow down. For some people, losing weight unintentionally becomes a concern, maybe appetite changes, other health issues. For them, the focus is getting enough nutrient-dense food to maintain weight, prevent frailty.
And for others?
For others, weight gain might happen more easily. For them, moderation, portion control become key to avoid gaining weight that can worsen things like diabetes, heart disease, joint pain. The goal is really a healthy range that supports your function, not necessarily chasing some number from when you were 30.
Got it. Lastly, she tackled specific nutrients and supplements, offering a pretty clear view.
Yes, especially calcium and vitamin D, which we touched on for bone health. For calcium, again, around 1,200 milligrams a day for women, and she strongly repeated the preference for getting it from diet first.
Right, listing things like dairy, fortified plant milks, kale, broccoli, some tofu.
Exactly, re-emphasizing that dietary preference because of those potential concerns with high-dose supplements alone. And vitamin D.
What about vitamin D?
Also crucial for bones because it helps your body absorb that calcium, but it also plays roles in muscle function, immune health, mood, even reducing fall risk. And unlike calcium, it's actually very common to be deficient in vitamin D.
Why is that?
Especially as we age, our skin just doesn't make vitamin D from sunlight as efficiently. Plus, many people don't get much sun exposure anyway, particularly in northern areas or during winter.
So for vitamin D, supplementation is often recommended.
Yes. She suggested that supplementing with vitamin D is often a good idea, especially if you live somewhere with limited sun or know your diet's low in it. She also said it's very reasonable, even advisable, to ask your doctor to check your vitamin D level with a simple blood test as you get older. That helps figure out if you're deficient and what dose you might need.
Okay, so dietary calcium first. Consider supplementing vitamin D and get levels checked. What about the huge number of other supplements out there? Are they generally needed?
This is where her perspective was quite direct. She's generally not a big fan of people taking tons of different supplements proactively, unless there's a diagnosed deficiency.
She shared that anecdote, right?
Yeah.
About patients with bags of supplements versus just a couple of prescriptions.
Yeah, a relatable story. Patients listing their medicines,
Yeah.
and it turns out they're only on a few necessary prescriptions, but they have this huge bag full of vitamins, herbs, various supplements they're taking based on something they read or heard, often without clear evidence it's needed or beneficial for them.
So her view is focus hard on the diet, deal with calcium and vitamin D as needed, but be pretty skeptical about needing a whole pharmacy of other pills.
Exactly. She encourages patients to ask why they're taking each supplement. Is there evidence it's necessary for their specific health? A whole foods diet usually provides most nutrients, reducing the need for tons of pills, unless a doctor identifies a specific gap.
That feels like a very practical, health-first way to navigate the often confusing world of nutrition and supplements later in life. Okay. As we start to wrap up this deep dive, Dr. Chun offered some really valuable resources for listeners who want to dig deeper, and she shared a truly profound anecdote that kind of highlights an essential, maybe less tangible aspect of aging well. What resources did she recommend for more info?
She suggested 2 highly reputable evidence-based sources. The websites for the NIH, that's the National Institutes of Health, and the NIA, the National Institute on Aging.
NIH and NIA. What kind of info can people find there?
She mentioned they have excellent resource pages specifically for older adults. You can find reliable, balanced information on things like healthy eating, detailed guides for specific balance exercises, instructions for strength exercises.
Like one she was talking about.
Exactly. Many of these resources include examples of exercises you can do safely at home, which is great if getting out is tough or you're just starting. So if you're looking for concrete examples of those 1-minute walks or sit-to-spans or want to learn more about specific exercises, those sites are a fantastic place to start.
So NIH and NIA websites, reliable, go-to sources for trustworthy, actionable info on healthy aging strategies.
Absolutely. A wealth of good information there.
And finally, she shared something she learned from one of her own patients, a moment of perspective that really stuck with her, and I think it will stick with us too. Can you share that anecdote?
Yeah, it was quite moving. It was a patient who, like many people, was kind of listing off the various physical things they were dealing with, acknowledging, my back hurts, my knee bothers me, the usual aches and pains that can pile up with age, a real list of physical struggles.
Okay.
But then, after detailing these difficulties, the patient paused and said something really insightful to Dr. Chun. They said, "But I'm not complaining, because every day that I wake up to those things, it's another day that I get to be here."
Wow.
Oh.
Yeah, that's powerful.
It really struck Dr. Chun, and it's such a powerful reminder for all of us, I think. The patient was expressing this profound gratitude for simply having another day of life, another chance to experience things, despite the physical challenges. It completely reframed aging from just a list of problems into, well, a continued gift.
Puts our own daily complaints, the minor aches we whine about, into pretty stark perspective.
Totally. Dr. Chun reflected on how easy it is for any of us, any age, to wake up and immediately focus on what's wrong. A small physical discomfort, a stressful day ahead, something someone said. But that patient, facing more significant physical hurdles, chose to lead with gratitude for the basic gift of being alive. It's a powerful lesson in mindfulness and appreciation, a reminder to pause and acknowledge the privilege of each day, even with its difficulties.
It's not exactly a medical treatment, but that perspective shift, that mental discipline, that can hugely impact well-being and how we actually experience getting older. A beautiful point to end on.
It truly is. It underscores that healthy aging isn't just about the physical or the medical stuff. It's also profoundly about our mindset, our ability to find meaning and gratitude in every chapter of life.
This deep dive really covered a lot of ground, drawing from Dr. Chun's expertise. We've looked at the vital importance of proactive medical care tailored to your goals, the absolute necessity of staying active, understanding even tiny steps matter, the crucial role of social connection for mind and brain, and those foundational principles of a balanced whole foods diet.
And woven through all of it, from the details of muscle loss to the power of friendship and the benefit of simple movements, is that consistent, really hopeful message. It is genuinely never too late to start making positive changes. Changes that can benefit your function, your well-being, your overall quality of life in the years ahead.
Thinking about everything we've discussed today, bone and muscle strength, keeping tabs on common conditions, trying to sit less, actively seeking connection, leaning into plant-based eating, maybe checking your vitamin D. What piece of advice resonated most strongly with you, the listener? Which idea feels like maybe the most achievable step you could start weaving into your life, maybe even today?
And maybe consider this. How might shifting your perspective, maybe away from passively managing decline, towards actively pursuing well-being, maintaining function, maximizing what you can do?
Yeah.
How might that fundamentally change the way you approach this next significant chapter of your life?
Thank you so much for joining us for this deep dive. We hope it gave you some valuable insights, solid information, and maybe some inspiring perspectives for your own journey of healthy aging.
Sure.